Hello, everybody. Good afternoon. It is my pleasure to be here today and talking to you about the pregnancy. Now, pregnancy can be a beautiful time, but sometimes it can be overwhelming as there are invisible and amazing transformation happening inside your body. But at the same time, you could feel excited, anxious, and worried. And there is a roller coaster of emotions going through your body. So, we are going to talk about all the changes that happen during pregnancy. So, it is always important to know about the changes and be well prepared and informed. It is a very exciting time, and you can feel a life inside you growing. So nothing could be more miraculous than that, because pregnancy itself is miraculous by design. So we have, divided the pregnancy in three trimesters, 3 months of each, and the total duration of pregnancy is 280 days or 40 weeks. So mid trimester or second trimester, as we call it, it is starts from 13th week up to 28th week. So today I am going to talk about the physical changes, that one encounters during second trimester. But second trimester is the easiest of all trimesters. One has the nausea and vomiting and all that morning sickness has faded away. One feels less tired, there is more energy, and worst is over. So you can look forward to taste of food, you can look forward to going out and enjoying yourself, because there are less pressures of pregnancy, as I can say it. So let us talk about physical changes one by one. The first thing is that uterus is expanding to make the room for your baby. And it is very exciting to see the baby bump, because first trimester you don't feel anything. Everything is hidden inside the pelvic cavity. But then you start feeling, and your baby bump starts to show, and you get that feeling, okay, now that I'm pregnant. So that joy inside, it is difficult to explain in terms that only a mother can experience, or a pregnant woman can experience. The breasts continue to grow in size, and you will find some changes, like the skin around the nipple becomes dark. There are some tubercles around the nipple. These are known as Montgomery's tubercles. And basically, sometimes there can be little liquid coming out of the breast, and that is, colostrum or preparation of the milk. So at this time, as the breast size is increasing, one must use a bra with broader straps, or you can also wear a sports bra for support. So that is going to make it, easier for you. Otherwise, it becomes a little difficult. But of course, tenderness of the breast becomes much less in the second trimester of pregnancy. The second thing that you may feel is Braxton Hicks contractions. Now, these are involuntary, irregular contractions in the uterus. So they may present as dull ache or sometimes tightness in your stomach. And these are involuntary uterine contractions. And they generally would go away after a few seconds. They come and go. But then that is a time you must consult a doctor. But otherwise, Braxton Hicks contractions are harmless. You don't have to worry about it. But sometimes after sex, exercise, dehydration, full bladder can also cause some tightness in the stomach. So you can just, rest and drink a lot of water, and you will feel at ease. And these generally subside on their own. And then one can encounter skin changes, and there can be the hormones during pregnancy, they activate the pigment cells, which are known as melanin. So one can see some brown patches on the skin, and we call it melasma. And of course, it would fade away after delivery. Then, there can be a dark line, down in your abdomen, starting from your belly button and going down. This is known as linea nigra. And it can be seen as the brown line going down, dividing your stomach. So that should also fade away. And another thing, one you can notice is the stretch marks. They are silverish, brownish, purplish, blackish, patches around your abdomen, buttock, breast, and thighs. Now, as the skin stretches, it breaks. Because of the growing uterus, the skin would break and it causes these lines. But generally, they fade away after delivery. They don't disappear, but they become lighter. So the best thing to do is keep your skin moisturized with anything, with any oil, with shea butter, with coconut oil, any moisturizer that you use. One can use bio oil, anything. The idea is to keep your skin moisturized so that it doesn't break. And then there could be hair changes. So, hormones tend to trigger hair growth. Your hair may become good, but not always in places you would like them to be. So, for example, you can develop hair on the face or armpits, but don't worry about it. It's just because of the pregnancy hormones that this happens. Then there can be, dull ache or a dragging pain in your stomach. Now, this is known as round ligament pain. So, what happens? The pressure of the growing uterus, it stretches the ligaments, and the round ligament, which supports the belly, gets stretched, causing dull ache or rarely some sharp stabbing pain. So, what you need to do is take adequate rest, drink adequate water, and you can use a warm bath, you can use a hot water bag, and these small things are going to take care of that. And but sometimes it could be a gaseous pain, and constipation also, it can lead to some gaseous distension. So that also can happen. So one can try some fruit salt, or maybe anything for gas, or your doctor can advise you something. So don't worry about it, but these are some of the common symptoms that I am talking about you may encounter during second trimester of pregnancy. And the most common is, the backache. You know, very often, patients come to us saying, our back is hurting, so no backache. So what happens? The progesterone, the hormone, or the hormones during pregnancy, they tend to relax the smooth muscles and ligaments. So because of that, and second, because of the growing belly, the center of the gravity shifts. So, one can experience low backache. So, what you can do is sit upright, and use a back support. Don't slouch like this, but sit upright and use some cushions behind your back, and that is going to ease backache. And of course, you can apply some Volini spray or some gel, just to give some temporary relief. You can also take a hot water bag, you can take a warm bath. All this is going to relieve you of the back. So don't worry, this is temporary, but of course you need to take adequate diet, which are rich in protein, because protein is necessary to maintain your muscle mass. So you need to take care of your diet, do some back stretches, take some back support, and that can help you get rid of your backache or minimize it. So next thing that you see is dental issues during pregnancy. So what happens, there is a lot of the blood flow increases to your gums, and because of increased blood flow, the gums become sensitive to brushing and flossing, and sometimes because their gums are swollen, it can cause minor bleeding. So what you need to do is maintain good dental hygiene. Use a softer toothbrush and be gentle with your floss. And it's very, very important to maintain good dental hygiene, because if there is periodontal infection, it can lead to intrauterine growth retardation or resulting in low birth weight baby. So one has to take care of dental hygiene so that the baby's growth doesn't get hampered. Another issue that one may face during second trimester are the nasal issues. So what happens as the gums become swollen? Similarly, because of the same reason, there is more blood flow to the mucous membranes. So your mucous membranes, tend to get swollen and because full of blood. So nosebleeds and stuffiness is very, very common. So don't worry about it. Just press your nose like this, apply ice, nothing to worry at all. Of course, if it happens repeatedly, you must see an ENT surgeon to rule out any polyp or rinse, and it will take care of the stuffiness. And one can drink a lot of water. One can use humidifier. Sometimes the dryness can cause nosebleed, and if put finger in your nose quite often, it can also lead to minor bleeding from the nose. So use a humidifier. And because if we are touching our nose again and again, there is some dryness around the nostrils. So use a moisturizing cream or maybe some Vaseline around the nostrils to keep the skin moist. So these are some of the things which can take care of the nasal issues which are seen in second trimester of pregnancy. Now, another common thing is dizziness. Since there are changes in the circulation and there is a growing uterus is pressing over the major blood vessels. So sometimes you may feel queasy, you can have a dizzy spell, you may feel there's a blackout suddenly. So it is quite common. So what you need to do is sit down or lie down, drink enough water, avoid standing for very long hours. Don't change your position suddenly, change your position gradually and lie on your sides and avoid lying on your back, because when you lie on your back, you can, sometimes it can press the major blood vessels. So it is always good. I'm not saying you have to only lie on your side, but it is always good to lie on the side and more so on the left side. So that will make you very, very comfortable. Now, a lot of patients, they come to us with leg cramps. So they will say, "Nas chad jati hai," and especially during the night. So why this happens is, see, leg cramps are generally due to deficiency of calcium, a deficiency of vitamin E, and a deficiency of salt. So what you need to do is add some salt over your salad. You can add some salt to the dahi or yogurt that you are having. Have some nimbu pani with salt. One must take a diet which is rich in calcium. So you have to take adequate dairy products like, doodh, dahi, paneer. So that should be part of your diet. It's going to give you calcium as well as protein. And then, of course, your doctor can advise vitamin E capsules. And another few things that you can do is, before going to bed, just stretch your calf muscles. And, that's going to help. Or a warm water bath can help you. Sometimes hot water bath can help you. And sometimes ice massage can also help you. So these are small things which one can try if there are leg cramps. Another issue which patients complain about is heartburn. So, as the pregnancy is advancing and the uterus is putting pressure on the stomach and intestines, And of course, hormonal fluctuations, as I said, the progesterone hormone, what it does is it smoothens your smooth muscles. And it also smoothens the ring of the muscle, which prevents your food and fluids coming back. So there is a small ring which is connecting your esophagus to your stomach, and that keeps your food and liquids in the stomach. But during pregnancy, there is relaxation of that sphincter. So, you feel that there is reflux, everything that you eat, tends to come back, or you may feel some heartburn or acidity. So it is very, very common. Don't worry about it. And what you can do is take small, frequent meals. It is not always possible to eat a big breakfast, lunch, or dinner. It will be very uncomfortable. You are going to feel full. So always small, frequent meals every 1 or 2 hours. It is going to help in digestion, and it is going to help in heartburn. It is good to take bland food, avoid spicy fried food because that's going to increase the heartburn. And of course, stay active, be up and about. The more active you are, the food is better digested. And of course, if it is still a problem, then consult your doctor, and your doctor can advise you some antacids. But this is very, very common. Another thing that patients complain of is breathlessness. Sometimes they feel out of breath. This is because the growing uterus puts pressure on the diaphragm, and that is your breathing organ. So in case you feel out of breath, then stay propped up. Instead of lying flat, you can use 1 or 2 pillows so that your head is propped up, and that will help you with the breathlessness. Or you can put your hands up like this. So this will take the pressure of the diaphragm, and this really helps if one is breathless. It takes the diaphragm moves up and relieving the pressure on the diaphragm. And of course, small, frequent meals, because if you take a big meal, even then one feels very uncomfortable. Another thing which is very, very common is vaginal discharge. Now, one doesn't have to get worried about every discharge. Some sticky, normal mucoid discharge is normal during pregnancy. But if the discharge is curdy, if it is foul smelling, if there is itchiness or pain or soreness, then you must consult a doctor, because fungal infections, yeast infection is very common during pregnancy. So please see a doctor so that they can make out whether it's a normal vaginal discharge or yeast infection during pregnancy. And of course, it is treatable. And then another common symptom during pregnancy is constipation. That is again because of relaxation of smooth muscles of intestine. So motility becomes slightly sluggish. So what one needs to do is take diet rich in fiber. So have lot of fresh fruits, have lot of green vegetables which are rich in fiber, have lot of fluids, have lot of water, and be active. And one must avoid constipation, but if not, it can also lead to problem of hemorrhoids or piles, as you call them. One can get fissure, and one can have bleeding while passing stool, which can be very, very painful. So at any cost, we must avoid constipation and take small measures so that our stool is soft. And in case it is still a problem, do consult your doctor, and they can give you some stool softeners, which are like enzymes which help in the proper motility of the intestine. And the most interesting thing that a mother feels during second trimester, we call it quickening. Or in fact, the baby starts to move. and one feels a fluttering, in the tummy, as if something is moving like a bird, some flutter like this. So it is a very exciting moment because that is the first time you feel, yes, there is life growing inside of you. So we call it quickening or baby movement. And so that is how it is. Initially, it becomes like a flutter. Then gradually, you feel the whole baby moving, and then one can start feeling the kicks and everything. Another thing which you can expect during pregnancy, people who have tendency, your varicose veins uh, can appear. And so the only thing you have to do is don't stand for long hours, and you can, avoid. But if they're very bad, of course, then you can use a pressure stocking. That's about it. Now, sex life does get affected, sometimes because of changing hormones, sometimes because of mood swings, sometimes because of physical changes. So communication is the key between you and your partner. But of course, sex doesn't hurt. If there is no pain or bleeding, then one can continue with their normal sex life. But in case there is any issue, then you must consult your doctor and must rule out any high risk factor like low lying placenta, or if there is any history of bleeding per vagina, then of course one is advised to abstain, but otherwise sex doesn't hurt. Now, another thing which is commonly seen during pregnancy are urinary tract infections. So, it is very, very important to drink adequate fluid during pregnancy. One must have at least 10 to 15 glasses of water. I know it is difficult to have during winters, but it is very, very helpful. It keeps your kidney flushed, because untreated UTI can also affect the growth of the baby, and if it increases, then it can lead to kidney infection. So urinary tract infection sometimes is symptomatic, like one may feel the burning or frequency of urination, but sometimes it is asymptomatic. So you have to be careful in looking at the symptoms, what they are. And then, we look at some emotional factors. Now, irritability, anxiety, this is very, very common. Mood swings, forgetfulness, and when we feel what is happening to them. But yes, it is all hormonal, and you must have a communication with your partner, and of course, the partners should have a develop an understanding that their wife is going through this, and whatever your concerns are. Sometimes there's fear, anxiety. You must talk to your doctor, because doctor is the one who can address your concerns. And of course, talk to your husband about the fears and whatever you are experiencing. And that really, really helps. So generally, I would like, these were the physical changes, in short, which one can encounter during second trimester of pregnancy. Now, in short, I would like to tell you, what do you expect when you visit a doctor? So every time you visit a doctor, you are going to be checked, for your pulse rate, your blood pressure. Blood pressure monitoring is very important, so we can catch any signs of preeclampsia or hypertension during pregnancy. You are going to be doing a physical examination with your doctor, because in second trimester, your bump is visible, and your doctor can see the growth of the baby by touching your abdomen, because we know at what gestational age, how many weeks you should be. So your doctor is going to do a physical examination, look for any signs of anemia, iron deficiency, look for any swelling on your ankles or feet. And swelling of ankles and feet is also very common. Some of it is normal dependent edema. So what you can do is, if there is swelling on your ankles or feet, put a pillow under your feet when you're sleeping. Or if you are working or you are at home, put your feet on a stool. Put them, high up on something. So that will take care of the swelling, which is normal. But if there is any undue swelling on your feet, do consult a doctor because it can be a sign of hypertension or impending, eclampsia or preeclampsia during pregnancy. And of course, your doctor is going to do your blood workup, like your general hemoglobin, to see any signs of anemia. One has to check for your thyroid function, any signs of hypothyroidism, because it can affect the growth of the baby. One has to rule out viral infections during pregnancy, so tests like torch and rubella would be done. One has to check for thalassemia profile, just to see if any of the partners is thalassemia minor. So if one partner is thalassemia minor, it does not affect the baby. But if both the partners, that means husband and wife, are thalassemic minor, then there's a chance that baby may develop thalassemia major. So one has to do that profile. One has to do liver function and kidney function test. Your doctor will advise when appropriate. And of course, you will be tested for genetic testing, like we do a double marker with PLGF, or if it warrants, maybe NIPT or quadruple. So your doctor will decide what tests to be done to rule out any chromosomal abnormalities in the baby. And of course, ultrasounds are done at regular intervals. The initial ultrasound is known as the dating scan. That is just to ensure that it's a normal intrauterine pregnancy and not a tubal or ectopic pregnancy. Then we look for fetal well-being, just to see whether the fetal heart has appeared and it's regular. Then the most important scan is a nuchal thickness scan, or level 1, which is done to see whether there is any chance of any chromosomal abnormality, and followed by a blood test. 20 weeks, we have an anomaly scan, because by that time, all the organs of the baby are almost ready. So, it's the most important scan. And then, of course, later on, a Doppler to see the blood flows and the lie and the fluid. So, these are some of the things that will be done on a routine basis when you visit a hospital. And of course, it always has to be accompanied by a healthy diet and exercise. And that I'm going to speak on Friday, which will be wellness in second trimester. So today, I am just going to tell you now in brief the warning signs, when to run and consult a doctor. So that is, if anybody has a vaginal bleeding, one feels there's a leaking or a gush of water, there is unusual pain at regular intervals which is not subsiding, if there is any discharge, so one must consult the doctor, or any severe pain. So these are some warning signs when you should visit your doctor. And of course, healthy lifestyle choices go a long way in doing a natural birth. And our hormones are designed for natural birth. So one must keep that option open, and one must try for natural birth, because it has so many advantages for the mother and the baby, giving the immunity, passing on the immunity to the baby, and the molding, and so many things, and the ease of breastfeeding. And of course, we are going to talk about all this on Friday, in wellness during second trimester. So that was all from my side in nutshell about the second trimester. And now I'm happy to take any questions if there are, to help you with it. Salon? Yeah, of course. You can get a massage done, but of course you have to avoid bleaching and coloring of hair and face with products which contain ammonia. So, second trimester is much safer, but avoid products which have ammonia.
Like cramps and winters.
Yeah, if there are cramps in winter, that's what I said. Take a hot water bath, stretch your calf muscles, increase your salt intake, increase your calcium. and take a diet rich in dairy. That would help. And take vitamin E.
My wife is in her second trimester. Is there a specific diet she needs to follow?
Yeah, the diet has to be balanced, consisting of adequate protein, fiber, folate, iron, green vegetables, fresh fruits. And I'm going to talk in detail on Friday about diet and exercise during the second trimester. Please log in to know more.
My baby is in her second trimester and she has a problem of bleeding gums and nasal. Is it dangerous?
No, no, bleeding gums and nasal problem is not dangerous at all. So as I said, tell her to use a softer brush. Okay, maintain dental hygiene. And for nasal problem, tell her to use saline drops, saline rinse. Okay, and she will be good with that. Thank you for joining. See you on Friday. Bye.